Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare.
Everybody, welcome Minna E. She's a pharmacist from Newcastle, currently on sabbatical, and I look forward to hearing all about it. So thank you for joining us.
Thank you for inviting me here. It's my first time in Brighton.
And we hoped that you will come back.
Well, the sun is out for you in Brighton today. I mean, it's always out because it's Brighton. It's always sunny here. So that's a little extra bonus for you.
Oh, wow, thank you.
You're welcome. We bought it for you.
You bought it with you, that must be.
From Newcastle.
From Newcastle.
Maybe.
Okay.
No, it's not like that in Newcastle at all.
So I was just interested if you could tell us a little bit about your career so far. So what has happened? Where did you study and what have you done since graduating?
Yeah, sure. So I didn't grow up in England. I came on a plane from Borneo, if anyone knows where that is. It's the same island as Bali, from a country called Brunei. So I was an international student in Sunderland University. I did my 4 years and then I graduated and did my pre-reg, what you call pre-reg year then. Now it's foundation pharmacist year, isn't it? And I did my foundation year in Sunderland Hospital for a year, subsequently became a rotational pharmacist and climbing up the ladders slowly, eventually became an advanced pharmacist practitioner. That's my official title. Fancy, but it's just an acute medicine pharmacist full-time on a busy ward, a bit after A&E for people who's not worked on acute medicine before. Loved my job. So throughout my career, since qualified, I've done various courses. So I did the clinical pharmacy diploma first of all. Then I subsequently took up independent prescribing, and I went on to do clinical skills course, and that was a fun course with working alongside physios and nurses on my course, just a different perspective of things. You kind of you work in the same clinical environment, but it's just a different skill set and background. It was quite interesting. So then subsequently, I think I decided to follow my passion. So 3 years ago, I set up a group called Pharmacy Declares. For those of you who haven't heard of it, we've got a website, Twitter page. Please check it out. So I've decided to take a sabbatical leave, and I currently live in Cornwall. I'm doing a master's in environment and human health. Just so much I've learned over the past 6-7 months already in terms of research skills. I used to be this person who hates research, statistics or data analysis. I hate it so much.
Love it.
I know. Do you know what? After this year, it's totally changed how I view it.
Oh, really?
I love it. Yeah,
I love it.
I've even considered maybe PhD as the next step. To do some more research.
Do it.
It was at Exeter University. I just rate them like the content and the delivery style. It's good. I'm pretty sure Brighton is probably the same. That's why you love it.
Obviously.
Yeah, I'm not saying that previous university wasn't good, but I think I just wasn't. When you're 19 and getting taught statistics, and it goes over your head. I just want to qualify and earn money. Why do I need to know this? But as long as you go along your career, you have to critically appraise evidence. follow the evidence-based practice, you appreciate even more now, when at this age when somebody teaches you that. So yeah, but I've got little jobs on the side as well if anyone wants to ask me anything afterwards. So I work on NHS 111 as a pharmacist, and during COVID time I did a bit of vaccinator in the GP hubs, and I was a locum community pharmacist for 5 years in Asda alongside my full-time job in hospital. So yeah, there's
a lot of stuff there. There's a lot of work and a lot of education. So how many courses post qualifying have you done?
Well, this degree will be kind of the fourth time I've gone back to university. I want to say I've gone back for the student card and student discounts. That's always
card,
good. Yeah,
yeah.
exactly.
As good a reason as any.
But yeah, I think I'm very into self-development, upskilling. There's always something to learn. I don't think you'll ever hit a ceiling, no matter how specialist you are. The world keeps changing. You have to adapt, and if you're not, you're just going to be behind everybody else. So I love learning.
Brilliant. Love it. Yeah. And I think what I've been learning so far, not being a pharmacist, but with the interviews that we've been doing and the chats we've been having, just how flexible the career can be if you choose to make it that way. So like you're saying, it's constantly changing. The jobs that are being asked of pharmacists are getting more and more varied. And if you can keep up skilled, then yeah, you're opening more doors for yourself.
Oh, absolutely. So, yeah, there's obviously the traditional ways of career paths that pharmacists has followed, but there are definitely of more variety, if you like, now, because we've gained more skills over the years, and the curriculum's changed so much, and we're more integral part of the the wider MDT now, the multidisciplinary team. So, yeah, the potential's endless, I think.
Yeah.
Yeah.
So I wanted to know what a typical day or week looks like for you. But so I guess you can take that as you wish. So at the moment you're on a sabbatical, so you're studying. But it sounds like you're still doing lots of things. So what would that look like?
So currently, I wake up whenever I want. That's great. I go to
that.
the gym. I spend endless hours in the gym, and I go surfing, and I, have a cafe by the balcony. That kind of life.
You have a cafe?
I have a cafe
I
cafe
see.
au lait.
Un
That's
café.
that one. So that's my current life, which I've never imagined having, because from what I've said so far, I'm pretty much, if you work up by now, a workaholic. So my life revolved around, pharmacy, work, how many people's on a tracker from A&E coming in. I need to help. I need to do extra shift. So this year, having that step, I think I burnt myself out, to be fair. So, when I said I co-founded Pharmacy Declares, and we took on a lot outside my full-time job.
Can you just tell us a bit, what is Pharmacy Declares? This is not something I've heard of before.
Oh, sorry, yes. So it's an environmentally conscious pharmacy professional group. So 3 years ago, during the pandemic, a few of us pharmacy professionals come together and said, what is it? How can we tackle climate change as a pharmacy professionals? What is it that we can do within pharmacy to reduce our carbon footprint? And we started that conversation. We didn't have a direction. So then slowly we gained traction, and we know we're working with multiple pharmacy organisations now, big level, high seniority NHS representatives in projects and guideline development. So a huge piece of work. So so that alongside a full-time job and my little part-time jobs, I think I just hit a ceiling and thought, I need to reassess my life. What do I prioritize currently? What's important to me? What do I actually want to do? So this year, having that step back has made me realize sometimes you do need a reset in life, don't you? So
you do.
To reassess what's important to you. So that's essentially what I did. So that my typical week before that, though, before my sabbatical break. So I do 2 13-hour shifts in acute medicine. So 2 long days and then 2 short days, 7.5. I leave at 4. But sometimes my long day I leave at 9, half 9, because it's just so busy. and you almost feel guilty for leaving, you know, a pile of work, and you just want to help out as much as you can. And I have a day off every week, but during that day off, all my life admin gets piled in on a day because, you know, I didn't get any chance to do them during the week. And you're so exhausted as well. It sounds, a day off sounds nice, but no, you're so exhausted you can't really do anything else. And when you hang out with your friends, you're just so tired, or, you know, you have leftover work. So yeah, that was what my typical week was like when I was a full-time
And
work.
then you decided to add in community pharmacy shifts.
Yes.
plus postgraduate studying.
Why not?
As well,
Just throw in some more. I think I prefer the sound of your week now.
Yeah, definitely.
With the surfing, the coffee.
Yeah, I think you do need to do that. Like, fair enough if you're young, and, you know, I think I'm not that old, but I've hit a certain age now where, you know, I worked throughout all my life when I was younger, and I think I'm kind of missed out in a sense. I probably shouldn't say this, but at one point I worked 22 days in a row. That's you know, burned myself out. By the end of it, you don't realize how much it affects your personal life as well. Like, you're irritated easily. Your friends think you're grumpy, and your family thinks that you're being nasty. But I can't help it. I'm just so tired.
Yeah. Well, good for you for recognising that and then pressing reset on it all.
Yeah.
I think that's very healthy. Oh, I have got another question. Sorry.
You have,
Oh,
but
I have.
I
have. I was still on that beach in Cornwall.
No, definitely. Yeah. Well, beach in Cornwall. I don't think you want to go back to do anything else. I think you've got it set. I'm quite intrigued by this NHS 111 in terms of shifts. What a shift would look like for that, and what was your skill set that you used for that?
Yeah, so I work for the North East Ambulance Service. That's, again, is an exciting job because I've never worked alongside paramedics. So it's not a profession that you work alongside a lot. So yeah, I got onto it during the pandemic, you know, when there was nothing much else going on at the time. I thought, oh, what can I do? You know, I want to fill all my time. I can't be, you know, sit at home all the time. So I took that job up. It's initially, it's quite, I thought it would be, you know, you follow a pathway, a triage, you know, you read off questions off the screen, but it's actually quite unhinged. So I'll have I'll have a deck of calls, if you like, on my screen. Say a normal, not busy shift, they'll say be a 10 people on the screen. And I can literally pick out any one of them. So on my screen, it would be patient name and it would be their problem. It can range from anything from missed medication ? To end of life pathway meds required, urgent. So yeah, it can vary depending on what you pick up the phone call as well. It can range from my patients missed their ferrous sulfate this morning. It's now 4:00. Can I give it? And you go yes, and they go, okay. Can you just code that? That's all. Bye. So that's one of the typical
Can you
calls.
just code that? What do you
So
mean?
someone has to be notified, if you like. I think the carers is kind of, I don't know what the policies are, but they have to inform a healthcare professional that this is an informed decision to instruct them to give them the drug at that time outside what's instructed.
What was normal, yeah, because it had been prescribed a certain way.
Yes.
For them to do something, they have to have a clinical decision.
So going back to the accountability thing that we've talked about before,
Yeah. So and then it could be ranging from so we're running out of levetiracetam ampules. We need an urgent prescription now. Where can I find this in local pharmacies that would stock it? Then you have to kind of ring around and decide urgency and where to send it to. Kind of facilitate that from the background. So yeah, it's a variety of calls. It's very interesting. Yeah.
But you make the call, not the call, but you make the decision then on triaging those patients, do you? Which one to ring first? And
you kind of do, yeah, depending on what. I suppose the initial call handler will say something on the screen, and they'll flag it like a 2-hour callback, a 6-hour callback. So the less urgent ones, you kind of know that they're least priority. For example, I wouldn't say the least urgent. When patients ring you, they're concerned about something and you have to address. So the less prioritized one, I suppose, are like, I've run out of my statin or my bisoprolol. Where do I find one? So as opposed to that, compared to I've taken an accidental overdose or something, what do I do now? Then you kind of judge that from which one you want to pick up first.
Yeah.
And what were the qualifications set that you needed to be able to do this? Do you have to be a prescriber?
No, you don't have to be a prescriber because there's GPs you work alongside that shift. There's prescribing nurses, prescribing paramedics that you work alongside that shift. So you don't have to be a prescriber, but you kind of have to know your clinical skills too, because you have to do clerking, if you like, over the phone to make sure that you clear all the red flags, you ask all the right questions, because it's over the phone as well. That's another thing. It's another skill set where you can't see the patient, you can't read their body language, you can't see what's going on. So that digital, skill set of triaging and consultation is a different skill set altogether that you have to kind of adapt to the tone of voice, or the whether they're actually in pain or whether they're just anxious. Or an example is when I did a consultation with a mother, she was so I need to ring 999, and my son is having an asthma exacerbation, it's worse it's ever been, and I need somebody now. Then you go, can I speak to your son? And you go, hello. Oh yeah, I've been the best I've ever been, for the week. I feel so much better today. That's just that.
It's hard.
It's really different to consulting people face to face.
Yeah, I mean that must require some careful consultation skills, because you're trying to then I don't know what the word is, not appease, but you've got to try to calm down the mother and reassure her. But her anxieties are real. I mean. Maybe not justified by that case, but the feeling of anxiety there is real, isn't it?
Yeah.
So have you picked up those skills through your work, or like you said, you did that clinical skills training course as well? Did that help with it?
I think it's more from working on acute medicine, really, because so the bit after A&E, people they want to find answers to their problem. That's the bit. And then you kind of have to do a lot of reassuring in that setting. Can I go home, or do I have to stay in hospital? Can I manage this at home? And the carers will be ringing, asking what's happening, what's going on. So there's a lot of that going on in acute medicine. I suppose that setting helped with my 111 shifts in terms of being able to triage more confidently, if you like. Because had I been just, I don't know, stuck in one specialty, I might not be able to answer a wide range of queries and calls. And do you know what? My community pharmacist shift actually massively helped. I knew I wanted to keep a hand in just to understand and keep up to date with, the latest PGD for UTI, the CPCS service, and what travel clinics are offering. And that if you don't know that and how things work in community, you can't help your patients and signpost them appropriately. There's a lot of people, I think, have that disconnect. If you like, when I say people, I mean the wider team. I think even pharmacy professionals don't know what we offer sometimes. So how do you expect the wider MDT to understand what we offer? So I think understanding what we offer, signposting patients correctly and swiftly and timely manner is quite important.
I think it's that, and it's come up a few times about that transfer of care and being able to say, right, you can get this from a community pharmacy, or no, you can go here. There's signposting where you can get things. Just from a lecturer standpoint, is the idea of your digital skill set and the digital triaging. Do you think that's something that could be taught? So you've mentioned it's come a lot from experience for you. Is that something you think could be taught, or is it just that students need to go out on more placements? What do you think?
Do you know what? There's a course on CPPE that actually has communication skills, especially for this. I think it was developed after COVID-19, when everybody goes to e-consult and kind of telephone triage. There's they actually teach you what you need to watch out for, and I suppose start from there. But I think it is shadowing probably what people say, or how they say it as well, the language you use, or how to confidently pinpoint, is this urgent, or is this anxiety, or is it something that can wait, and prioritize that way. And I do think it comes with experience, because if you're new and you're not sure, you don't want to confidently discard that. You want to check with another colleague, if you like, but I think it does come with experience, but knowing the basics of it, it probably set you for that.
Definitely. Cool.
What do you enjoy most about your work in pharmacy?
So I love pharmacy. I think we have so much.
We need T-shirts with that. I heart pharmacy.
I heart pharmacy. We have so much potential, to transform healthcare. And I don't mean to sound cliche, but I think we're currently underutilized at the minute. There's so much we could do with our, we know prescribers are coming out when they're graduated in 2026. So what does that mean for our future workforce? So we are the front door, if you like, before they actually reach secondary care, before they reach their GP. We're so accessible. You don't have to make an appointment to see us. I'm talking about community pharmacy in specific. And currently, we're under-resourced, understaffed, everyone's under pressure and burnt out. I think if the government decides to fund us properly and utilise our potential, we could ease a lot of NHS pressure. We can help a lot of patients and keep them healthy in our communities. So what I like that element about pharmacy, but what I like specifically about my job in pharmacy is the difference I could make to patients on a ward. So every intervention I make, every consultation I make, it's that, realization from the patient and go, this is what's been causing my side effect to I've been feeling awful all along. Thank you so much for pointing that out. Nobody's said this in the last 10 years. And I've been weeing, all night from taking furosemide just 10 o'clock at night. So you just, using your skills and, and reading the room as well, I suppose. So, for example, clues from the bedside, they haven't taken these meds, paracetamol, the full doses, because the carers come in twice a day. They don't have the lunchtime and tea time dose. And then they come in with uncontrolled osteoarthritic pain. You go, they've already picked 1 gram QDS of paracetamol and they're now on, higher opioid doses. Why are they still in pain? And then you kind of look and go, aha. So things like that I like to pick up on, if you like, pay a detective work.
I was gonna say detective, and then I was gonna ask, do you like watching detective shows? Because it's exactly what it sounds like, and I've thought that before, and I've seen some of the problems that our students have to do in like OSCE stations and things, where they've got to try to figure out what medication is causing this, and it feels like a bit of a detective problem. So, do you like watching detective shows? Is that something that you've always been into?
So, the last detective-ish kind of show I watched was Enola Holmes on Netflix.
Oh, yeah.
I like that.
Yeah.
So, no, I think it's a little bit of arrogance on my side, probably. I like to be proven right, I like diagnosing and think that this is what's caused that. I've solved the problem now. Goodbye.
I think we all like to be right.
Oh, absolutely. Love it. Yeah.
Yeah, so I like to, holistically think that your traditional scientific approach didn't work by many investigations and many consultations before. What is it that we're missing? So I kind of want to look outside the box and think, okay, is it this? Is it is it your social care? Is it that holistic view? It's such undermined resource currently in terms of managing people's health, and we talk about a lot of social prescribing and all kinds of things. I think we need to move away from the medical care aspect of patients to more a biopsychosocial kind of factors to look at social determinants of health and all kinds.
Yeah,
so, I like to do that.
It's a slow move, isn't it? Because I think it is becoming more, like you've spoken about, social prescribing, and we have moved some way away from the medical model. But it still feels slightly like there's a very much an emphasis on physical prescribing, on looking for clinical causes for any symptoms that you see or any presentations that you see. But looking at the wider context as well. So what social support has this person got? What's their diet like? And bringing in all of those factors as well. So important.
Mm-hmm. Absolutely. And I think it's because that's much harder to tackle. Say a simple infection, antibiotics, give them for 5 days, clear, done. That short-term thing where these other wider social determinants, to tackle them takes months, takes years, and and it's an ongoing maintenance thing. And who is looking after them outside that medical model? Do we have enough link workers? Do we have enough social workers? Do we have enough carers in community that's knowledgeable and equipped enough to do the job? I don't think we currently do. And until we reach that, we're gonna be stuck in this, trying to get someone seen and resolved within your healthcare setting in the limited time and resource we have, to then looking at the wider picture of how to manage their care. I think it's a tricky balance.
Very much so.
I like that. That kind of sung with you, didn't it, Shani?
Well, it did sing with me when you said the biopsychosocial model. I was like, yeah,
Like,
totally
I'm just
into
gonna
that.
go.
I'm just going to
I
have
don't
that.
need to be here.
Yeah.
It's you two just hit it off straight away.
Well, you know what? I will just go on a little bit about it. But I started at the university 15 years ago. And at that point, it was really a novelty to have a psychologist as a full-time member of lecturing staff in a pharmacy programme. And I remember the GPHC coming in to accredit us. And I remember a couple of them, they were really quite excited by the thought that there was a psychologist here and saw that as such what do I want to say? Such a selling point for Brighton that they recognised, and this is one of the reasons I love Brighton, that they recognised the importance of bringing the psychology aspect into it. And yeah, we've still got to bring in some of the social aspect perhaps, and but yeah, just thinking a bit more widely about healthcare, so important. So yes, I did run with that. Thank you very much.
Loved it.
What next then? I mean, other than saving the planet, what next in your career?
That's an interesting question because at this point I don't know. So,
keep enjoying the sabbatical, I'd say.
So yeah, this year's actually opened my eyes to a lot of more opportunities because I think I kind of hold myself into, the traditional elitist pharmacist, if you like. Maybe I look into being a ACP, and that's an advanced clinical practitioner where you get more skilled. And I have an ACP in my hospital who works in A&E who injects propofol for people, make them to sleep, and then they go to intensive care and put some leads on people, and in a peri-arrest situation and all the cool stuff. So I thought I wanted to be one of them. I actually thought about retraining as paramedic. I thought about doing all kinds of things. And now I actually don't know, because with all this sustainable healthcare thing that's going on in the background, I think that's where my passion is. So maybe a future career, I shouldn't tell this because my boss might be listening, a future career in a sustainable healthcare would be ideal, but I also would like to keep my hand in clinically, because I don't want to lose touch with what's going on the ground, because the reason why I can promote sustainable healthcare is because I understand where the faults are, the waste are coming from, and how can we do things better, and I do those things myself. So I need to kind of plot what I want to do essentially. But you know what, one advice I'll give to the students now is there's no hurry in your career. You're in this career, you graduate, you're going to be in there 40, 50 years. There's no need to there's no need to hold yourself into I'm going to be a band 6 or 7 by this point, and 8 in this hospital, and do this course and be this person by this point, and join this club and be this consultant pharmacist. Yeah, you can do that if that what's floats your boat. But I think increasingly I find the younger generation are more looking at their lives in a more, if you like, what's the word? I don't want to single out all the Gen Zs, but so they value social life more. They value what's outside of a job more. Things that they do voluntarily, things that they go traveling, they go, they just don't view that career as like their life essentially, and I do admire that, because I wish I was like that. So yeah, where was I going with this? Next in my career, I don't know. It's a blank. It's a blank.
I can almost guarantee for you that it will be filled with something that's useful, listening to what your career has been so far. And the fact that you are following your passions, like you said, your passion is sustainability, but you want to keep your foot in with the clinical work. You're clearly following the things that motivate you and interest you. So I predict for you a career that is very productive and adaptive to the environment that you're working in. And I don't mean just like the environment. And I've turned into a clairvoyant all of a sudden. Like, if you want to know, Connor, what your future holds as well, I'll read your palm
crystal
too.
Ball? You've left it in the office.
It's under the table.
Yeah, okay.
You just can't see it. Where was I going? I don't know. But yeah, so The environment of the pharmacy profession is changing, isn't it?
Yeah.
We've seen that. It's very flexible. The jobs that are available to you as a pharmacy graduate are becoming more varied. So, yeah, who knows what the future holds for any apart from me. I know what the future holds.
And you're not going to tell anyone.
I'm not telling.
With that stack of salbutamol inhalers.
Yeah.
There's a reason.
You're right.
I think there's something quite scary but also exciting about not knowing what's next, and I think you having the sabbatical and like reframing what matters to you is quite interesting, that you've actually given yourself that chance. And also now the fact that you still don't know is also completely natural, and it's obviously, it will come, these things will happen naturally, and you have passions, which is great. So like you said, your future is bright. Maybe a PhD at Brighton.
Oh,
You never know. Yeah,
you never
maybe.
know, exactly.
If the sun continues shining today, you might find that you'll stay for another 4 years.
Yeah, but you're moving from Cornwall. I mean, it's
It's not been kind of great sunny days in Cornwall so far. I think I've been missold Cornwall a bit, but yeah, maybe Brighton is where it's at.
You never know. I've heard that's where it's at.
Oh, I see.
So I've never been invited to where it's at, but
I don't think I've ever been
No,
invited
you
to
haven't.
where it's at.
you haven't.
Or you might end up on a remote island with it.
All of that segue was absolutely seamless.
Wasn't it?
Yeah, loved it.
You might end up on a remote island where you are the only healthcare professional for 100 people, and we were wondering what 3 things you would take with you.
Related things.
Health-related
Yeah.
things you would take with you.
Okay, I thought about this, long and hard. So what would I take with me? I think first of all, I would take my pseudocreme.
Okay.
It's for everything. It's for wounds. It's for acne. It's for cosmetic purpose. It's great pseudocreme. Preventative purposes, for a barrier cream for infections. So yeah, to keep all my my population of 100 skin and acne free, I would take my
Brilliant.
pseudocreme.
Okay.
So that's my first one. Second one, so obviously I want to link this to climate change. I'm going to take antihistamines. So in a tropical island, or I don't know what kind of pollen's going to attack me, because I've got severe hay fever and all kinds of allergies. So with climate change and global warming, pollen allergenicity is increasing. So that means that loads of people now, if you ask them, they're experiencing allergies and hay fever, which they never have before. Why is that? So again, linking to how the pollen's staying in the air longer, and they're more likely to cause people asthma exacerbation, COPD exacerbation. So in my remote island of all kinds of tree pollen and grass pollen, I would like to take my antihistamines for me and my population that might have respiratory illness and allergies of all kinds.
Fantastic.
The third one, I thought about antibiotics, but then in my 100 people island, I don't think there's an infection outspread of any kind, was there? So
Interesting.
And the pseudocreme's going
Well, the
pseudocreme's
pseudocreme's going to prevent it, so
it,
it's fine.
So they're not antibiotics. But then I thought about this snazzy gadget that my consultant loves. It's called the point of care ultrasound. POCUS.
Seen.
Point of sound ultrasound.
Point of care ultrasound. So yeah, it's a little ultrasound which is meant to replace stethoscopes in the future.
Ah.
So bedside diagnosis of like I say before in the first question, I love to know.
Yeah.
I just want to be proven right. So I like my little ultrasound. Have a look at your heart. What exactly is causing this murmur? Have a little look. Have a look at your fluids in the tummy. What's going on there? Have a look at.
Oh, interesting.
It's like when you have a look at your baby ultrasound.
Yes.
It exactly that image. Black and white.
Yeah.
And some lines going through on the screen, but different parts of the body.
Oh, that would be handy.
And
Of course.
Is it on the phone or tablet?
You can have it on an iPad. You can have it on your phone. You can clip images from it. You can clip videos from it, and you can show your colleagues if you find anything interesting.
I can see you're excited with that, and you'd be able to like diagnose loads of things with it.
Yeah.
But then the only thing that you can prescribe is Sudocrem.
Oh, yeah.
Like, oh yeah, sorry.
There's that.
Heart failure, Sudocrem.
I can get the satisfaction for the patient who wants to know what's wrong with them.
Oh yeah.
And then they can live with knowing what's wrong with them.
However long that might be.
Oh, I have to look this up. I've never heard of this.
POCUS, yeah.
POCUS,
so
okay.
increasing loads of medical professionals now are taking it up as an additional course, if you like. And there's accreditation for it now as well, for all kinds of nurse practitioners and paramedics are using it as well. I think it's still quite new-ish, if you like, technology, but increasing healthcare professionals are using it.
Interesting. How would you measure success on this island in terms of the products that you'd taken, do you think?
The number of people alive by the end of the year, I suppose.
Oh, yeah? Okay.
And quality of life. I can't remember who I had this conversation with. Oh, it was I went to a menopause training now for the last week with a group of women who said that they haven't got access to HRT because the GPs are very cautious about prescribing them stuff, and they knew I was a pharmacist, and they asked me what I thought about it. So I thought it's that quality of life versus risk, the risks of long term. Do you want to live longer and not prescribe them and risk of that risk of cancer of kind from taking HRT, or do you prescribe them the HRT and make them absolutely brilliant for the next, wonderful life for the next year, but you might cut them a bit short? Which one is it? So maybe one of the measure is how happy they are, because I think. What's the point in living if you're not happy? Yeah.
It's
happiness.
I heard on another podcast recently about how maybe we should be, rather than aiming for happiness, because actually I'm a strong believer in embracing all emotions, that we shouldn't just strive just for happiness, that our life is about experiencing all emotions, sadness, maybe anger a little less, but joy and happiness as well. But that to measure your day by how often in the day do you feel alive? I quite like that. I'm just going to put that out there.
That's
rather than,
though, isn't it?
Well, and happiness isn't subjective.
I guess. I suppose how do you rate in scale? How do you feel alive?
Yeah, but I mean, all of that is about quality of life. However you want to define quality of life, but yeah, and so we have. Yeah, are you going to measure success as longevity or better quality of life? I don't know. But for me, quality of life is going to be a bit more about feeling alive rather than feeling happy.
I think that's fair.
Thank you.
Just like you said, you can't be happy all the time. And then if you're striving for happiness and you don't get it, then you'll be sad more of the time.
There is that.
I love that that's the two answers have been quality of life and how many people are still alive.
Mm-hmm. Yeah.
I'm waiting for other answers to come out. I mean, it does seem like pretty sensible.
Yeah, it does. And I like that you've taken some slightly different healthcare items onto your desert island, because I think lots of other people have gone down the antibiotic or the vaccinations or pain relievers. But I love the Sudocrem. I'm going to give one little story about Sudocrem as well. Oh. Sorry. I love summertime. Actually, no, this isn't a summertime story. So summertime is good for my skin. Wintertime, less good for my skin. Everybody's skin gets dry in the winter, doesn't it? It's all the central heating and whatnot. And so I'm used to putting just moisturiser on just to make everything feel a bit better. And this moisturiser just isn't doing it. It's not cutting it. So I put Sudocrem, slapped it onto my legs. It's a nice thick moisturiser. I didn't know. Look, I'm not a pharmacist. I didn't know it was like going to act as a barrier. So I just had to walk around with very ice creamy looking legs. Yeah. I couldn't sit down anywhere, so I was just leaving white paint marks everywhere. I soon learned. Not long after that, I taught the skin workshop. Anyway. Oh, Minna, thank you so much for coming in.
Oh, thank you for inviting me here today. It's been a pleasure to chat.
Fascinating, and given me lots to think about in terms of sustainability and what I'm going to do with those blue inhalers in my cupboard. And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics introduce you to incredible individuals and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub Podcast.